So let's go ahead and welcome Jennifer Weber from Cayman Islands Health City. Good morning, Jennifer. How are you?
Good morning. I'm great. Thanks. How are you today, Sandy?
Yeah, I'm doing fantastic. So you're looking good. I like that top. Very pretty.
Oh, thank you.
Yes. And then we also have Dr. Vikas Roshan, who's also here with us. Good morning, Doctor.
Hi, good morning, Sandy. Thanks for hosting us. Thank you.
Yes, absolutely. It's always a pleasure to have the good folks over at Health City here with us in the program. So we're going to change gears a little bit in terms of the topic of discussion. So now we're going to be talking about Cancer Survivors Day, which happens to have been this past June the 4th, where people around the world recognize cancer survivors and raise awareness of the challenges of cancer survivorship. And this is the 36th annual National Cancer Survivors Day celebration of life. So, Doc, I think we could say with good confidence, thanks to medical advances, more and more cancers are survivable. And so this is a good thing, of course, but there are some unique challenges that certainly come with the journey once you've been diagnosed with cancer. So let's talk a little bit about how Health City Cayman Islands remains committed to really providing optimal care for those who've been impacted by the disease. So, of course, it's just, I think, an amazing opportunity. Let's go and bring in some slides about what Cancer Survivors Day is. Again, it's an event that's observed every June the 4th, and really just about raising awareness. And the recent opening of the Radiation Oncology Center is a huge landmark for healthcare in the Cayman Islands, in particular for cancer treatment. So let's talk a little bit about what that facility will mean for so many people here. Dr. Vikas?
It's actually, we started this facility on 17th of May. Mm-hmm. And on the first day, we treated 5 patients. And for a new center, treating 5 patients is a great thing. Mm-hmm. So on the very first day, we treated 2 patients with radiosurgeries, and that is a very high-end procedure. So basically, radiosurgery is when, as compared to conventional radiation, we give a very high dose of radiation per fraction. And why is called surgery? Because it's an ablative kind of thing. We burn the tumor inside the body, and it's non-invasive kind of thing. And other 3 patients we treated with the volumetric modulator arc therapy. We call this VMAT, and it's also very high-end technique. So it was a very great day, I think, for me as well as Cayman Islands, because it's the historical day that we started radiation here. Yeah.
Mm-hmm. Okay, very good. And you've had, like you said, some patients already coming through the door and already utilizing the facility. So, Jennifer, this is an amazing 70,000 square foot modern state-of-the-art medical facility, sort of phase 1 of what's happening at Cayman Bay. Tell us a little bit. I know that obviously you've been to the facility, you've had the opportunity to tour it. What can people expect when they go to the new Radiation Oncology Center?
So the new Radiation Oncology Center it's funny, when people walk in, the first comment they seem to make is, "Oh, this looks like a spa." It's a beautiful, light, bright, open, modern facility that is designed to be relaxing and echo what we have in the community, which is all the colors of the sea and the beach in the front lobby. But it is one building that surrounds this super high-tech piece of equipment, which is called a Siemens TrueBeam linear accelerator. And when people come in, they can sit, relax, and then when it's time for their treatment, Dr. Vikas and the team, it takes 3 people. They take them back, and for those who are looking on the screen, if they are on Facebook or on YouTube, they can see a picture. Patient walks into the back room, which looks beautiful. They're helped up onto the table, and their treatment is provided by, courtesy of that very high-tech machine. The patient doesn't feel anything. And before they know it, they are done. The number one comment I've heard from patients when they leave their treatment is they walk out and they say, "Oh, that was faster than I thought." Yeah. So
Yeah.
it's been amazing. Dr. Vikas and the team have done such an amazing job of making people feel comfortable, and people and I've been there most days, and especially in the beginning when we first started, and patients were coming out. We had one patient who actually had tears in her eyes. She's had radiation before on different parts of her body. And she literally had tears in her eyes and said she just can't believe she gets to do this here at home.
Mm,
And
wow.
that makes me cry too.
Yeah, no, that's truly amazing. Um, so tell us, Dr. Vikas, a little bit about how this facility is different. This type of treatment is different, and just a reminder to our viewers of who could benefit most from this type of radiation oncology treatment.
So this is like a state-of-the-art machine that we have here. It's a true beam linear accelerator in which we
Mhm.
can treat tumors from head to toe. So all the tumors which are present in the body, this can be treated with this machine. So radiation is basically a localized kind of treatment, and when the disease is confined to one particular part, then only we'll prescribe radiation. So it
Mhm.
depends upon actually what kind of stage with which the patient is presenting to us. Most likely, the radiation is required in stage 1 to 3, and in stage 1 to 3 it's mostly as a radical kind of thing, and in stage 4 we do treat patients with the radiation, but in those cases it's a more of a like a palliative, and it's
Mhm.
just we treat patient just to alleviate the signs and symptoms of the patient. So
Yeah.
besides providing the conventional radiation, we are able to provide the higher end radiation techniques also, like
Mhm.
IMRT, image guided radiotherapy, VMAT, radiosurgeries, electron
Mhm.
therapies. So even for skin cancers, we have the, because I think on island it's more in number. So we have
Mhm.
electron therapy for that, and electron therapy is a very good effective modality that can treat tumors uh, and as a primary sole modality, as well as when someone has operated on those patients, and just to avoid the disease returning back, we add radiation to those patients. So more,
Mhm.
besides having said this thing, there are other techniques like a total body irradiation that we can do in conjunction with the, when we have to when we the patient is undergoing bone marrow transplant, that kind of thing. And suppose in, there are certain cases in which the lymphomas, in which the whole body is actually involved in, for that also we have a total body irradiation. So actually with this machine we are doing all kind of procedures, and soon I
Mhm.
think in the next 3 to 4 months we are going to add brachytherapy machine. Brachy means when
Wow.
we are going to place the sources directly inside the patient's body, near to the tumor, and the
Yes.
benefit is that that gives very high curable dose to the tumor, and at the same time we are going to save the near adjacent structures. So I think that is a, so these two machines are going to do,
Mhm.
I think, wonders on the island. Yeah.
Wow. So just to be clear, the Radiation Oncology Center will be adding additional services, including the external beam radiation therapy, 3D conformal radiation therapy, intensity modulated radiation therapy, and image guided radiation therapy. So different types of therapies, which have found, I'm sure, to be beneficial for different types of cancers and so forth. So this is really, really fantastic. Special services will also be offered. So this is just the beginning. They're just kind of getting the doors open, electron therapy and brachytherapy services as well. So lots will be happening at that radiation oncology center. It's just the beginning now. So a bit of fantastic news there for sure. So yes, thanks for that additional information. G says, wow, Grand Cayman has come a long way. I haven't been there since 2010, and I probably wouldn't recognize things. And I lived there from 1995 to 2000 as well. So, yes, lots of changes. And in this regard, I'm happy to say that the changes are very, very positive. So, here we have a slide telling us a little bit about what radiotherapy is. So, perhaps, Dr. Vitkus, you can walk us through a little bit of this one.
Yeah, actually, the image that you can see is a, you can see there is a mask that is just for immobilization of the patient, so that patient should
Mhm.
not move during radiation. And with the same mask, we do one CT scan, and in that CT scan, we actually delineate tumor where it is, and we delineate the adjacent structures also. because with the new and techniques, we can just focus the radiation to at that particular point where the tumor is, and
Mm-hmm.
at the same time we can preserve the adjacent structures. So you can see this is a image where we can where we are treating the patient on the machine, and we just match the patient as per the previous CT with the help of these lasers. And when this, and after matching this, we'll do one CT scan, and this CT scan will match with the day zero CT scan. And if the both are matched properly, then only will give a radiation. This is a kind of quality assurance test for us, and we can give very higher dose perfection with this kind of techniques. So this is a very advanced technology that we are using here for our patients. Yeah.
Mm-hmm. Okay, so I see you say it's very important for patients not to move. So you put that kind of protective, mask in place so that they don't move their heads. I see.
Yeah, because we plan a very high-end cardiac procedure. So if patient moves during radiation, during the when we are delivering the radiation can it can be deposited some other part, and
Mm-hmm.
it can harm the patient instead of giving benefit to it.
Mm-hmm.
Yeah. Yeah.
Very good. And so then what can the patient expect during the actual radiotherapy procedure?
So actually, most of the patients are a bit they're confused, and they think that they will feel some kind of pain during the treatment. It's a kind of invasive kind of treatment, but when they go through the process of radiation, they'll find this is non-invasive kind of treatment. It is not going to cause any pain to the patient. It's a painless. Patient cannot feel the radiation. They cannot smell it. They cannot sense it. So
Mhm.
it's a non-invasive treatment that gives cure as good as surgery. So patient actually prefers radiation with the
Mhm.
prefers the radiation. And moreover, when the patient is inside the bunker room, so no one is inside, but still we can communicate with the patient. So patient should not feel a patient can't feel alone in there. So in case we also teach them, in case they find any difficulty inside the treatment room, so that they can just ring the bell, so that can we come to know there is some issue, we can just go inside, and we can deal with the patient. If there is any issue, we can sort it out then and there, and we can again start the treatment. So it's a kind of quality assurances for us, so that the patient, whatever we are planning, patient is getting that kind of treatment.
Mhm. Fantastic. All right. So how many patients have you had since the opening of the facility?
Right now, on machine, we have 15 patients, but 14 patients are waiting for the treatment.
Wow.
And somewhere we are touching 40 plus patients right now.
Wow. This is fantastic.
Yeah.
Very, very good. So again, the first patients, my apologies, were treated on May the 17th. Of course, this is being a historic moment for Health City Cayman Islands and the Cayman Islands as a whole. And the oncology team administered 2 radiosurgeries and other high-end techniques like the volume modulated arc therapy. These things sound so sophisticated. The patients, which included 3 women and 2 men, ranging in age from their mid 40s to their late 70s, received treatment through again this high-tech laser true beam variant linear accelerator. Wow, that's a mouthful.
It is.
So, and that's you right there in that picture, Dr. Vickers. You were there, front line and center.
Yeah, I'm taking the selfie. Yeah. Everyone is behind me. Yeah.
All right, fantastic. So let's talk a little bit about the cost of cancer, because when we talk about, the concept of sort of cancer survivors and some of the things that they go through in observation of National Cancer Survivors Day. Of course, the biggest prohibitive, element to getting really good quality care is cost. I mean, you've got insurance that may have restrictions in place. People have difficulty when they start thinking about how much is this going to really cost me. So let's talk about some of these elements, Jennifer. So leading cause of death worldwide, claiming some 10 million lives annually.
Right.
We have incidents on the rise due to aging population, smoking, alcohol consumption, unhealthy diets, sedentary lifestyle, and air pollution. So all those are contributing factors. And there's a study published in the Journal of the American Medical Association, Oncology, that estimated that the global economic cost of cancers between 2020 all the way up to 2050 it's going to be around $25.2 trillion. That's crazy.
We used to say when we were emphasizing billion, we would say billion with a B, right? So that people would understand we weren't saying million. In this case, we have to say trillion with a T.
Gosh. This is unbelievable. That's a lot of money. But of course, we know that with cancers, there's so many different types of cancer. So this is what makes, cancers challenging. It's not like you're just fighting one particular type of cancer. Like basically, Dr. Vitkus, is there any area of the body that a cancer, cannot infiltrate? Because you've heard of eye cancers, brain cancers, throat cancers, tongue cancers. It's like everything pretty much can get cancer, skin cancers.
So it's actually everywhere. So all the organs can have this cancer. So, but the good thing is that if we can screen the cancers, so I think we can save this cost, right? So because this cost is because when the patient required more than one treatment, like suppose if the disease is locally advanced or stage 4, patient needs surgery also, radiation, chemotherapy, and now immunotherapies and all that. But in case of screening, we can find tumors early, and in those scenarios, maybe one modality is enough. So I think if we increase our screening programs, we can reduce this cost. So I think that is the way around it. Yeah.
Yes. Okay.
Yeah, there's a lot that can be done, Sandy. We can treat what the cancers that already exist right now, and thank goodness Health City has this oncology center here in Grand Cayman, because this makes it so much more cost effective to be able to get this treatment at home. That when you're finished, you can just go back to your normal life instead of having to travel overseas and stay overseas in a hotel for perhaps 2 months at a time. And it also makes it so that your friends, your loved ones can be there and support you, check on you, know how you're doing. A lot of people can actually just go back to work right after they finish their treatment. They start treating patients at 7 o'clock in the morning. Some patients, depending on how they're doing, in other treatments that they're having, they finish, they go grab a coffee, and they head to the office. So there's much less disruption in their life. And much less expense. If they stay home here, it's more accessible, it's more affordable, and we can help patients maximize the insurance benefits that they have so that they pay less out of pocket for things like those hotels and airfare and all those extra ancillary costs to travel.
Right. So the highest economic burden, I thought this was interesting, is from lung cancer. So those of you who are smokers, please remember that. We've got followed by colon and rectum cancer, breast cancer, liver cancer, and then leukemia. So those are kind of the top ones. And then China in the US, I thought this was interesting, faced the largest economic cost of cancers in absolute terms, accounting for 24.1% for China and 20.8% of the total global burden, respectively. Wow. So 24.1% of the global financial burden is from China, and then 20.8% from the US. I thought that was quite interesting. Now, China has, I guess, a huge population, but also perhaps, a lot of things not in place as it comes to especially lung health, the environment, protecting, the air quality and so on in China is probably very, very different. So the Radiation Oncology Center, tell us a bit more again about how that can, really save patients money. So
yeah, we want to make sure that people understand that, there's Health City has been treating cancers in various ways since 2014, when Dr. Vinitha, the first resident medical oncologist, came on island. And since that time has just been adding more and more service. But one thing that is new about this is that this capability of doing radiation oncology is brand new in Cayman. Nobody else is doing this. This requires such specialized equipment and such specialized skill that it's been a long time coming. And now that we have it, we have all what it's called modalities, all 3 modalities to be able to be treated here in Cayman. If your doctor says your cancer needs to be surgically removed, We have a surgical oncologist. If it needs to be, if you need chemotherapy and other kind of medical interventions, we have a medical oncologist. And now we have a radiation oncologist and all the bells and whistles and equipment to be able to take care of that. So this is something really remarkable, not only for our island nation, but also in our region. We also are going to be treating patients from other places who are going to be coming here because it's accessible, it's affordable, and the technology is so high. So right now we actually have a patient from overseas who is being treated. And if I'm not mistaken, we'll be finishing treatment soon and able to head back to their own country. And it's remarkable that they can come, be still in the Caribbean home, but not have to go to the U.S. where costs are so much higher.
Mm-hmm. Absolutely. All right,
So
fantastic.
So one thing I want to add here is the importance of multidisciplinary tumor board that we're having on every Thursday morning. So because there are medical oncologists, radiation oncologists, surgical oncologists, pathologists, and radiologists, so everyone is there, and the treatment that we decide, it depends upon the discussion that we had, and I think it's a good to be treated under a team as compared to some maybe under a single person. So this MDT that we have, this has a very important role in the management of malignancies. So we'll come to know what is the best possible outcome for that particular patient, depending upon his age, stage, his performance score, and all that. So I think the MDT that differentiate us from the various cancer facilities on the island, and I think people should use that facility. Yeah.
All right, very good.
Yeah, when patients are treated at Health City, I think one of the special benefits that they don't even know that they're receiving is they're getting all of these doctors as a team in a room discussing their cases. So sometimes people say, "Oh, I have this illness. I wish I could get a second opinion." When you're getting treated at Health City, you're already getting not only a second opinion, but you're getting a multidisciplinary team approach of not only the doctors who are treating you, but there are other doctors in the room too, because sometimes patients have other health issues as well. So when you have a whole team of doctors who are reviewing your case and everybody's looking and discussing all of the issues at once, you can feel very confident that you're going to get excellent care with everything being considered from multiple directions and perspectives.
Right. All right, very good. So we do have a caller on the line. Good morning, caller. Welcome to the program.
Good morning.
Morning.
Regarding a good diet, we need an ideal amount of antioxidants as part of that diet to be healthy. But regarding your targeted radiation, if someone is unfortunate enough to need to have radiation or your new, by use of your new equipment, would one need to modify their diet regarding antioxidants since it's targeted, or?
So actually, with the radiation that we're using here, it's almost the same radiation that you're using everywhere. So I think there is no point in changing that diet. But there are there are studies which are mixed kind of results that we should avoid antioxidants during radiation, because radiation acts by generating oxidants that damages the DNA. But the results are not that. You can say it's not supporting the thing. So we are not asking any patient to avoid particular diet. So with radiation, you can take antioxidants, although even we prescribe also. Yeah.
Okay. All right. Thank you.
All right. Thanks very much, caller. 936-2626 is the telephone number. So do feel free to give us a call if you have any questions. So let's just talk about what a survivor is. So life after cancer. So of course, the survivor is anyone living with a history of cancer from the moment of diagnosis through the remainder of their lives. Jennifer, talk about some of the ongoing and often long-lasting hardships that cancer survivors will be facing?
Yeah, through the years, I've known a lot of them. Cancer survivors sometimes they have long-term physical and emotional side effects. They have an increased risk for second primary cancer and other health problems. Sometimes it can be financially devastating for patients. Because of the outside costs. Some people suddenly take a loan or suddenly have expensive treatments, and some people don't have insurance when they start. That people sometimes say, oh, well, I can do some fundraising, or my friend said they're going to have a fish fry for me. And that's very nice, but that is not going to cover the cost of cancer. Without insurance, it's just not possible. You can't fry that much fish. And so we at Health City, we do a lot to make sure that patients are insured, get the help that they need. And one of the things that we're working really hard on is helping patients sort of cobble together all that they need in terms of insurance. So if they have a basic SHIC, SHIC, standard health insurance contract plan, a low-level insurance plan, that they also get a secondary plan, or they might also, if they qualify for other services, they might be able to get other charity services or government services that might be able to help them, so that they, at the end of their treatment, they aren't devastated and full of debt, so they can get through their treatment and then go on with their life. And another thing is the complete difficulty of getting and keeping employment. Sometimes if people who develop cancer have worked for a small company, for example, as much as the company might like to be nice and keep that person on, sometimes it just isn't financially feasible for them to do so. A big company has the more of an ability to be able to keep people on. But smaller companies don't always have that capability. And so a lot of times people end up, they've beat cancer, but then they don't have a job. And so it can be really difficult for people. And the effects are often long lasting, not only, like we said, physically and emotionally, but emotionally as well, because when patients are going through the treatment, first there's the shock of the treatment, and then they just sort of take everything step by step as they go through their treatment. But then at the end, a lot of times it's really difficult for patients, because then they have time to stop and think about what just happened to them. And oftentimes then that's the moment where they go, oh my gosh, I really dodged a bullet. And then they start thinking about all what might have happened, what could have happened. Yes. And that can be a difficult time for patients as well. So, having things like support from your family and your friends, developing a cancer support group, making sure you reach out for help when you need it, whether that's at the beginning by saying, hey, I've been diagnosed with cancer, I need help with my insurance, or I need help with the finances, or I need help psychologically. Those are all important things so that patients can do as well as possible as they go through their treatment.
Absolutely. So a couple of questions. Natasha says, how much focus is there on diet for cancer prevention and treatment?
So
Sorry, Dr. Vikas, I'll say some non-medical things. One is just that, yes, Health City now has the ability to treat lots of cancers right here in Cayman. We wish there was no need, but unfortunately there is a need. And so we're here to help and treat that. Health City has also done so much in the community for early detection work by doing community events and talks and helping people understand what they can do and what tests are available to catch cancer if it exists as early as possible, because we all know that early detection saves lives, right? And then backing that up, we're always trying to talk about cancer prevention as well. By doing things like smoking cessation programs and going out into the community to help people understand what they can do to reduce their risk of developing cancer in the first place. So I think there is a focus on not only the people with cancer, but very much the other side of it too, trying to make it so that we don't need so much of this service in the community. Dr. Vikas?
So from treatment point of view, if we add a good diet to a patient, so that actually enhances the effect of treatment. So the the common problem that comes with while treating the cancer patients is in those patients who have head and neck cancers and food pipe cancers. So because they when they come to us, they already have stopped eating in view of they have difficulty in swallowing and all that. So before taking these patients up for the treatment, so we need to take care of their dietary thing. So for that, we sometimes we advise them to meet your primary dietitian, and the
Mhm.
required calories that we need before starting the treatment is at least 1500 to 2000 calories per day patient should take. Patient should increase its weight, and then only it should come for the treatment, so that in those scenarios the treatment does wonders. So sometimes we also help patients to increase the intake, like sometimes we change the consistency of the food from solid to liquid, and sometimes we take the help of some tubes like Riles tube, which we put through the nose, and we'll
Mhm.
start giving nutrition to the patient. And in those scenarios, we tell the patients to take at least 2 to 3 liters per day through that tube, so that he should gain proper weight before coming for the treatment. So these are the things that we actually offer to the patient.
Right, very good. So Jim says, as long as we continue using the types and amounts of chemicals to be sprayed in our food sources and types of greens we feed our livestock, treating mosquitoes and what we're putting into our grounds, as well as the modified foods, we'll continue to see cancers and other illnesses rise. Can we talk about this? Are cancers actually on the increase? And if so, what is the science saying about why?
So in as mentioned, a very good causes, and I think now people are associating these causes with the cancer. So like the food that we are eating, that contains a lot of preservatives. So these
Mhm.
preservatives has a direct association with the malignancies. So I think we should avoid kind of preserved foods, and we'll switch over to the fresh local foods which are available on the island, instead of the foods that we are getting from the outside. So that one thing. Next is the spray that we are doing. Maybe I think we may be using DDT or organophosphorus spraying. So during so when we see the literature, that is it's showing that organophosphorus compounds, they are associated with more with the brain malignancies. So this is a definitive proof actually. So like environment pollutants, and sometimes we are giving hormones also to the animals, and we just make them grow and for getting ready for for us of the food and all that. So that also it's not clearly mentioned, but there are at least signals that we are telling us, okay, these can also lead to malignancies because it contains hormones.
Mhm.
So I think these are the I think the viewer has very good knowledge, and he has posed a very nice question. So that I
Mhm.
think it's they think things are already associated with malignancies, and we should take care about uh, these things. We should deal with them very carefully. Yeah.
Okay.
And,
So
and
just
Sandy, sometimes I
yeah.
feel like, sorry, but sometimes I feel like, people want to have a direct cause and effect
Mm,
uh, mentality about cancer,
mhm,
and we just have to be really kind of cautious
mhm,
about that. Yes, sometimes people say, "Oh, well, this person has lung cancer. Well, he got it because he smoked." Well, that we can't assume and assign blame
mhm,
to patients or people who have been impacted by cancer. There are a lot of reasons and a lot of ways that people get cancer. We can't,
mm,
as individuals, all control this. And as the doctor was saying, of course, there's things that we can do to mitigate our risk and reduce our risk. And all of us should try to do everything we can to reduce our risk for sure. But
mm.
even by doing that, there are going to be some cancers. And so please, I just want to caution people. I've heard so many people through the years, I don't know, kind of blame others by saying, oh,
Mhm,
you got cancer because of this or that. And we need to be patient and kind to each other and make sure that it really doesn't, when somebody has cancer, they need our love and support. And
mhm,
they need all of our efforts to try to help them get through it. And of course, if
mhm.
there are things that we can all do to make ourselves healthier, we should try our best to do those things.
Yep. So finally, how do you support cancer survivors? So we have a list of things here. in line with what Jennifer was just speaking about. So number one, understanding that the cancer journey doesn't end when treatment ends. There's physical side effects, which should be taken seriously. Provide emotional support and watch for signs of PTSD. Be present and patient, and also give them space. Some people just need to sometimes be alone to process what's happening to them.
Yeah, I think a lot of times what I've seen with working with cancer patients for so many years is the patient tends to do better through the time that they're actually having their treatment, because they can focus on the next step. And it's their loved ones, oftentimes their partner or their spouse, who are the ones in the background who just feel so helpless because they don't know what to say. They don't know what to do. They don't know what to support, how to support them. And then when the treatment ends, that's when the patient starts going, wait a minute, what just happened to me? What did I get through? And they have scars, or they have, they're growing back their hair, and all sorts of other physical reminders. And that's when the people around them tend to go, oh, well, thank goodness that's over. And now we can move on. But that's right when the patient is really kind of processing, like you said. So it takes a lot of time. It takes a lot of patience. And I think it goes both ways. The patient has to make sure that they reach out to those they love, and the people who love them have to make sure they sort of check in and say, how you doing? It's been 3 months. It's been 6 months since your treatment ended. It's been a year now. Is this a celebration? Is this an anniversary we remember? Ask the questions, have those conversations, and help each other through. There's a real ripple effect. The friends are sometimes traumatized. Your friend gets diagnosed with cancer, and then suddenly you're in the mirror checking to see if you have cancer too. It can impact everybody, not only in the inner circle of the family, but the extended group and friends as well.
Okay. All right. Very good. So thank you guys so much for joining us this morning. Again, just an amazing discussion. Cancer Survivors Day celebrated around the world, 36th annual. I think most of us know someone who's had cancer, or perhaps who's going through a situation now where they're receiving cancer treatment. Just be there for them. As Jennifer said, ask what you can do and how you can assist. And that's probably the best way to do it.
And if there are people who are cancer survivors who are listening, I want them to know that the Cayman Islands Cancer Society has a cancer survivors dinner every year. It's free for cancer survivors, and they can call the Cancer Society and get on the invitation list. I'll give you that telephone number. It's 949-7618. I'll repeat it, 949-7618. You can call and you can say, hey, I'm a cancer survivor. Can I come to the party? And so they will put you on the list. You can go to the Cancer Survivors Party. Every year it's a different theme, and it is a real celebration of life. And so it is really inspirational for people who are currently going through treatment, or maybe they've just finished. Sometimes people feel like, I don't know if I want to go and hang out with a bunch of other people. I don't want to talk about my cancer. But then they walk into that Marriott ballroom and they see the place is full of cancer survivors, and it makes people have a lot of hope, because they see a lot of people have been through it, and then people stand up and they're 20-year survivor, 15-year survivor, etc. And by the end of the night, everybody's feeling really proud of what they've been through and proud to be survivors, and that just helps everybody.
All right, a few more comments. Rachel says, thank you for this informative session this morning surrounding cancer. And thank you, Jennifer, for highlighting people that are caring for persons with cancer, that they do so much with empathy and care. There's nothing worse than watching someone irresponsible, chaotic, mentally unstable, and narcissistic actually in control of a cancer patient's care, while the patient themselves are trying to cope through the diagnosis. P.S. You don't care if you read this, you know who you are. Oh my goodness. Sounds like that's directed at someone specifically. Jim says cancer is for and affects everyone, not just the individual diagnosed with it, as seems to be the case for sure. Alejandro says some were smokes, most are not, and apparently it can be somehow passed on if contaminants are on the clothes and hair. And then times, I guess, no knowledge of the danger took place. I think he's referring to asbestos. And obviously, we do know that there are certain chemicals and certain things that do cause cancer. We know that smoking, you shouldn't smoke. I mean, the list of cancers associated with smoking is pretty long. We know that asbestos. Now, we might not have known that, 50 years ago, but now we know asbestos can't be used in buildings. If you're doing construction in older buildings that have asbestos in them, you have to take extra care in putting on a hazmat suit and trying to protect your lungs in particular and trying to protect yourself.
And we don't need to be angry at our grandparents for having us in the car when they were smoking, 50 or 60 years ago, when they really didn't know. But now we know better and we can do better.
Yeah, absolutely. All right. Thank you, Dr. Vikas and Jennifer Weber, both joining us from Cayman Islands Health City. Again, we were talking about cancer survivors and everyone who, is going through a cancer situation right now or who've gone through it before. Know that there are support groups. There's help out there for you. You just need to perhaps do a little bit of research and reach out to someone if you, need mental and emotional support. So thank you guys so much.
Thank you.
Thank you.
All right. Have a fantastic day.
You too.
All right, folks. Again, another wonderful segment from brought to you by Health City Cayman Islands. Every Tuesday, they are here joining us with amazing information. Let's just take a quick commercial break and we'll be right back after these messages.
Have you completed and returned your business survey forms? The deadline for the annual business surveys is June 16th, 2023. The surveys are confidential under the Statistics Act and exempt from the Freedom of Information Act. Your response matters. Do your part. Fill out and return your forms to the Economics and Statistics Office. For assistance in completing the forms or for more information, visit www.eso.ky or call 244-4676 or 244-4600.
All right, folks, welcome back to the Cold Hard Truth. We're going to talk a little bit now. I see a lot of you were a little bit distracted in the comment section, not focusing in class. I did see that. So we will talk about what is on everybody's mind. Thank you, Miss Tanya. She says, thank you for all the information. It's very hard. One feels helpless when a loved one is fighting cancer. And absolutely, I mean, there's so much that you feel that you should be doing. And sometimes you don't even know where to begin for both the person who, has received the diagnosis as well as those trying to support them. So it can be, just a very, very precarious and emotional situation for sure. But thankfully, with better treatment options available, even on island, as we've said this morning, there's always that ray of hope and sunshine at the end. So let's just continue to educate each other and continue to learn and hear from the experts on where we're going. Yeah. So.